Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Rise of anti-science rhetoric has fundamentally changed the relationship between doctors and patients. The author, an infectious diseases physician, describes the growing challenge of vaccine hesitancy and anti-vaccine sentiment among patients, which is fundamentally changing the relationship between clinicians and patients. The author notes that conversations about routine preventive care, such as vaccines, have become confrontational, with many patients shutting down and refusing to engage with evidence-based information. This dynamic is devastating for physicians, who are charged with protecting patient health, but now find themselves unable to deliver safe, evidence-based care due to the erosion of trust in institutions and public health. The author describes the emotional toll of these interactions, feeling nervous and uncertain before routine discussions, and worrying about appearing pushy or triggering defensiveness. The author argues that this crisis of trust has serious consequences, including the resurgence of preventable diseases, increased strain on healthcare systems, and the unraveling of public health progress. Clinicians cannot compete with the speed and emotional manipulation of modern disinformation campaigns alone and need support from stronger federal communication, social media platforms, public health agencies, and political leaders. The author also emphasizes the need to protect clinicians emotionally and professionally, as the systemic erosion of trust is contributing to burnout and making it harder to recruit the next generation of healthcare workers. The author concludes that silence on this issue is no longer acceptable, and that leadership is urgently needed to address this growing public health crisis. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak